Okay, so chapter 38 about diabetes, and I know you're not doing diabetes till the summer, so I've really condensed this chapter, and as you study diabetes this summer, you will get more information that you can grasp better. So I'm going to take you through. At the end of this, I'm going to tell you just briefly what you need to cover in chapter 40 and 41. Remember, we're skipping chapter 39. So in the beginning of your chapter, page 631, look at box 38 too. Read over on the glucose control mechanisms. Read on insulin, glucagon, and corticosteroids. There's some important information there. And then here we're going to get into the insulin, which starts on page 634. So with your different types of diabetes, your type 1, which is insulin true insulin deficiency. We used to call it insulin dependent diabetes, but now we call it type 1. Type 2, it's an insulin resistance of some sort for multiple things. So you try to deal with lifestyle changes, weight, food, diet, oral medications, and eventually have to add in some insulin. Gestational diabetes, which occurs during pregnancy. They are not diabetic before, they may not be diabetic after, but because of pregnancy, you do not give oral antihypoglycemics. During gestational diabetes, it is treated with insulin. So your glucose, your insulin is your key. You need insulin to be able to get the glucose to enter the cell, otherwise it stays in the bloodstream, so you will have hyperglycemia, but they feel like garbage. Insulin is described more, page 634 in your text. Read that whole paragraph that talks about insulin. It is exogenous insulin is the only parenteral anti-diabetic agent available for exogenous replacement. Our insulin is a hormone in our body, and we have to replace that insulin. Read over, focus on safe medication administration. Please read that box there. On page 635, table 38-2, it just gives you a list of the different types of insulin and usual indications. Box 38-5, very important for you to read over the external insulin pump section of that. Under present, just go down to the bottom, external insulin pump, read over that thing, have an understanding of the insulin pump. Oh, I actually have some pictures here. The different types of insulin, the injection sites, it's given sub-Q. There's a 50 unit, 100 unit insulin syringes for your sub-Q. Here's a picture of an insulin pump. Mixing insulins, which you will often mix the regular and NPH. You clear before cloudy. This is a picture of an insulin pen. If you haven't administered any of these yet, it'll make more sense as you start to do them. Page 636 in your text, read over your pharmacokinetics section, all of your contraindications and cautions section. Let's see, clinical important drug interactions, especially your beta blockers. If you remember with your beta blockers, they can block your reaction, so your hyperglycemia, so you want to avoid beta blockers on diabetics or those taking insulin. So read over that whole the clinically important drug. It goes on to the next page, so read that. Here is a picture for the peaks and onset and peaks of your insulins. Your main focus here is on your onset to have an understanding of peaks for your regular insulin, which is Unilin R and Novolin R, and your NPH on peaks. As your text talks about, it has a section there that I told you to read on pharmacokinetics on page 637, talking about why you give NPH and regular for the peak times, because if you see the onset and peak overlap each other, so it gives them good coverage throughout the day, mixing those two. So on your prototype insulin chart, I want you to put some numbers in order of your onset, from the earliest to the longest for onset. So your first one that has the quickest onset is your glulisine or Apidra, it's 2 to 5 minutes. Your second is Lispro or Humalog, which is less than 15 minutes. Your third is Aspart, Novolog, 10 to 20 minutes. Your fourth is regular Humulin-R, Novolin-R, 30 to 60 minutes. Your fifth is MPH or Novolin-N, which is 1 to 1.5 hours. Number 6 is your Detamir or Levemir, 1 to 2 hours. And number 7 is your 2 glargines, whether it's Lantus or Trujea, which is about an hour. Anything else on that chart in there, cross out. Those are the ones I want you to focus on. Nursing considerations for patients taking insulin, please read over that whole thing. There's several important facts throughout those sections. Things I think are already pointed out, like looking at your skin sites, rotating your sites, nutrition, what else? Your regular insulin is one that's given IM or IV. It's the one for your when you need it in rapidly for emergency situations. You always give regular insulin. Read your cautions when mixing your insulins. It talks about your beta blockers, so read through those considerations. On your critical thinking scenarios, 640, 641, I would focus on your patient teaching on page 641 in there. Page 642, definitely read all those key points. Your glucagon is at the end of this chapter. It's on page 650, chart 38.4. Read about your glucagon, counteract severe hypoglycemic reactions. Read your prototype summary there. Read your assessment history and evaluation on your nursing considerations. And then get back over here to your oral antihypoglycemics. This will help you actually when you get into more of the med-surg end of it. We'll get back into diabetes more then. For now, on table 38.3, starting on page 642, the only ones I want you to focus on is your second generation sulfonylurea or glyburide or diabeta. Down to the bottom, bigubanide, your metformin, definitely read all of that. And metformin is the only one you're going to give for your type 2 child diabetic. On page 643, meglitides, I want you to focus on netiglanine or Starlix. Look at your frequency, read over your usual indications, anything you need to worry about with it. And also on page 644, so I told you to focus on your second generation sulfonylurea glyburide. They do have a prototype summary of glyburide on page 645. Also, your second generation sulfonylureas, beginning on the bottom of page 644. Read through everything. Read through starting at your contraindications and cautions, adverse effects, drug-drug interactions, and your prototype summary. If I were to give you those three, the glyburide, metformin, and your netigladine or Starlix, in a question that you'd be able to distinguish which one would be given for what reason or why, or one over the other. Your metformin prototype summary is on page 648. Let's see, nursing considerations. I would look over assessment history, implementation, rationale, and evaluation. Bottom of page 649 has your key points. I would definitely read all of those key points there. And I already talked about your glucagon. And then this last slide I was going to talk about, but we're going to skip over that since you haven't done diabetes yet. This last slide I just thought was cute. And while that slide's up there, skip over page chapter 39. Go on to chapter 40. The only section of chapter 40 I want you to focus on is your estrogens. So I want you to go to page 676. No, back up. Page 6. Page 674, pharmacokinetics, no, not that, on estrogen. Your page 675, contraindications and cautions for estrogens, adverse effects of estrogens. Page 676, clinical important drug-drug interactions of estrogens. Please definitely read through that. I think that is it. On page 678, your nursing considerations. Read over your assessment history and examination. And that is all for that chapter. Flipping through it, I believe that is it for that chapter. Over to chapter 41. Page 693, table 41.1. There's several different types of androgens. If you notice, everything is oral except for testosterone. Be familiar with your different routes for your testosterone administration. Nursing considerations for patients receiving androgens. Read your assessment history, implementation rationale. Definitely read your evaluations. It's over there on page 696. On your prototype summary, testosterone, look over your adverse effects. It's also in your key points on the top of page 696. Anabolic steroids. Read that entire section, everything about anabolic steroids, all the way through the adverse effects. Box 41.3 on 697. Just focus on your section on creatine, which is one of the students did an excellent job covering that. Critical thinking scenario, page 698. Read over the discussion section. Let's see what else. Go to page 702, table 41.3. Focus just on the two that students presented, this sildenafil and tadalafil. They are both PDE5 inhibitors. Look over their reasons. Either are given there in your usual indications. They're both oral. Look over your clinically important drug-drug interactions for that section. Look at your prototype summary. And on your nursing considerations for patients receiving these drugs, look over your assessment history, examination, implementation rationale, and your evaluation. Read over your key points section. I think that's it. Trying to look over your chapter summary, but no, I don't think you need to worry about that. And that is everything. And hopefully you read my email and you're going to go into the chapter online, like I said, and between these and that and your student presentations, you will be prepared for this test. Thank you.